Welcome. I am Dr. Pierluigi Mancini, and I am the Director for the National Hispanic and Latino ATTC and PTTC, which is housed at the National Latino Behavioral Health Association, or NALBA. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States, and our mission is to address the disparities affecting the behavioral health of Latinos. Thank you for joining us today for the part 5 of this 5-part series called Platicas, Latino Well-Being During COVID-19. Today, we're excited to present the final part of this series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. I would like to thank NALBA's COVID partnership with the Morehouse School of Medicine's National COVID-19 Resiliency Network for helping make this series possible, and how right now for community education resources in English and Spanish at quehacerahora.org. This Plática is also made possible by the funding support of the Con Alma Health Foundation. For the past 2 months, NALBA hosted a professional expert in public health, behavioral health, and the field of medicine to share their insights, advice, and tips on taking care of yourself, your family, and your community during the COVID-19 pandemic, and what additional resources are available to help. We hope you have enjoyed the series. Let's begin by welcoming our special guest, Dr. Elena Rios, the president of the National Hispanic Medical Association, who I have had the pleasure of knowing for many years, and whose amazing work in serving Latino families is well documented throughout the United States. Dr. Rios, welcome. It's good to have you with us today. Please say hello to our audience.
Well, thank you, Pierluigi. It's a great to be here, an honor, and I look forward to our discussion.
Thank you so much. To get us started, here's how today's Plática is going to work. Dr. Rios and I will have an open conversation about how Latinos have been impacted by COVID-19 and the work that she's been doing toward that end. And I have several questions kind of to get the conversation started. But I really encourage our listening audience to submit their own questions and ask directly to Dr. Rios anything that they may be wanting to find out more about. So with that said, let me get started by asking Dr. Rios if you could please tell our listening audience a little bit about your professional background, your current work, and how you got to be here today.
Well, okay, well, let me give you the short version. So I'm from California, from the East Los Angeles area. I grew up in Pico Rivera, which is a small suburb southeast out of LA. And, you know, when I grew up in the 60s, it was pretty much Caucasian, and the Mexican-American young families, you know, were buying their first homes. My father was a factory worker, and my mother was a housewife. And I think after about 5 kids, my brother was born after, I mean, he was the 5th. And my mother went to start working. And in the when I was in high school, my mother was studying to be a nurse. She was working as a unit secretary and in the nursing office secretary in a community hospital there in Montebello. And anyway, I ended up working there, volunteer as a candy striper, and then as a messenger on Friday nights during my senior year in high school. And I think, you know, it was just important to realize how you could get comfortable in a setting when you experienced it, being around nurses and orderlies, you know, young doctors. And anyway, so to make a long story short, I went to I actually won a math contest and got a 4-year scholarship to an all-girls high school, Sacred Heart of Mary. And then I went on to Stanford University, got more scholarships. And I just said, oh, I'm going to be pre-med. I want to, you know, stay in the healthcare arena. And but my mother was very involved with the Democratic Party and fundraised for, Hilda Solis and Gloria Molina and the Roy Ball family. And, so anyway, I think, and going to college with so many Latino first generation students in the 1970s, who were very activist. One of my roommates was a daughter of a farm worker general that Cesar Chavez sent to Texas to start the farm workers movement over there. Another one, her mom was a vice president of LULAC for women, the feminist side of things. And, it's just very nice to be able to have a family away from home of young Latino Chicano activists interested in doing what we could for our communities. And my focus was on pre-med, human biology, but everything I did was about organizations. M.S.P.H, I started a group of recruiters, of having students from East San Jose, Black and Latino high school kids come to the campus. And anyway, so I ended up really wanting to do organizational development. I'll just call it that. Didn't know what I was going to do. Interested in healthcare and interested in community health. So I put two and two together and figured out I'm gonna do something that's related to making change, policy, organizations. And I ended up coming to Washington, D.C. as an intern before I graduated. So I didn't go straight to medical school. I went to public health school. Wow. And then the rest is history. I went to medical school, UCLA, public health school, UCLA, and ended up starting I connected medical students in California. We started our own Chicano Latino Medical Student Association. And then we ended up developing the Latino Medical Student Group, the national group. And by the time I finished my medicine residency and then a fellowship in policy research, I went to work for the government of California and then jumped to the White House. And at the White House, the doctors that I invited for the Clinton healthcare reform, we decided to start our own organization called the National Hispanic Medical Association. So I'll stop there, but that was 1993, 94. And then I jumped into the federal government for about 4 years, and then and have been with NHMA ever since, our National Hispanic Medical Association.
Thank you so much. It's just, it makes me so proud to know you and the work that you've put together to help all of us, because what NHMA has done throughout all these years, bringing Latino physicians and other healthcare providers together to further the cause, to help us in making sure that we are represented, that we have the benefits, that we have the services and the access and the ongoing work. It's just really an honor. And anyone out there that wants to follow the lead, I mean, you can do amazing things in this country if you put your mind to it. Is the bottom line. So thank you for sharing that. So let's turn the conversation now then about where we are today and what brings us here today, which is what we're facing in the country, but specifically as Latinos with COVID-19. So I know you work on a national, international arena. Can you tell us a little bit how you've approached and what kind of have you been doing to address COVID-19 and specifically to help the Hispanic community?
Well, from the Washington, D.C., the organizations that are Latino have a report that we put out for the presidential transition. So we were very involved, myself and other leaders within our organization, in putting together our healthcare chapter. And since COVID had started in March, when everything, we were told to close down our offices, we decided that we would add in COVID-19 into that report. So that's the first thing we did. The report did not get released until the end of the summer. It was meant to be for the Democratic and Republican conventions, but I think there was just so much distraction this summer that that the organizers couldn't finish it, but it was finished in time for this transition. In terms of our efforts for our own network, and our network, like you said, is health professionals, nurses, dentists, doctors, mental health workers, social workers, dietitians. We invite everyone to a webinar series like this. We started our webinar series in May, monthly webinars on COVID-19, and by having speakers share what they were doing, people, doctors working in hospitals, nurses working in nursing homes. We had focused on mental health, on focus on telemedicine, just different things that of importance to our communities. And every speaker talked about the impact in their Latino community, whether it was from the West Coast to the East Coast to the border, the detention centers. So much has been happening to Latinos. So we've been trying to share, and we're going to continue the monthly series in January. And then the other thing is we really have just had our chapters around the country also focus in on what are issues because of COVID-19, people losing their jobs, and other consequences that have been very detrimental to our communities.
And so, in the scheme of things, how has COVID-19 then, what have you seen or what have you heard from your members about how COVID-19 has changed how they're serving their community? How are there struggles that we're having in getting healthcare, or even some of the statistics that show that people of color tend to have higher mortality rates? So
Yeah.
what have you seen about COVID-19 changing
But,
community?
well, first of all, we realize that the data is not there. This country has never really focused on healthcare data by race and ethnicity. It's always been optional or self-reported. And CDC, the Centers for Disease Control and Prevention, which is our public health agency at the federal level, gives money to the states for our local public health departments. They finally mandated that we needed to have data to understand where the COVID-19 was happening. And in all the states that do have Hispanic, African American, Native American, all our Caucasian data, uh, we've seen that Latinos especially, Latinos and Blacks, but Latinos especially, have much higher proportion of people having cases, like 3 times higher, and I think 4 times higher hospitalization rates, and then twice as high death rates. And I think the major reason is because our communities where we live and work, first of all, Latinos are more lower income, having to work a couple of jobs to make ends meet, and essential workers, whether they're in the food industry, farm workers, meat plants, chicken, poultry, or they're in the supermarkets or in the hospitals, the cleaning crews, or working in homes, cleaning homes and stuff like that. So we have the essential worker problem, and then we have the second issue for us is the large families and or multiple families and multi-generational people living together in overcrowded housing. And then we have what are called the social determinants of health, where our communities are poor, less educated, not having, we don't have good cars, or no cars. I mean, people in certain cities just rely on buses and public transportation. And so we're always around a lot of people. So the transmission of the virus, COVID-19, is much higher in these living conditions.
And speaking of that, and I meant to ask you this a little bit earlier, but would you mind taking a few moments and letting our audience know, how would you explain what is COVID-19? What is this virus that people are talking about? And why are we so afraid, and why is it that we need to take care of ourselves and those around us?
Yeah, it's a new virus that came from uh, the animals. I think it really came from bats in China, and in a place where people eat bats. And there may have been a crossover from an animal virus to a human virus, which can be very bad. But this one happens to be related to a SARS virus that we had before. Um, but I think what's most important for people to know is this is a much more contagious virus than other viruses that we have seen. Probably not since HIV, when AIDS first came on the scene in the 1980s when I was in medical school. Everybody was afraid of the patients that had it because nobody understood what it was and how it was transmitted. But we do know, because it's related to the SARS virus, which was um, a flu, right? It's a respiratory virus that gets transmitted in the air, but also it can stay on surfaces, and it's aerosolized. So it's either by touch or aerosol, that aerosolized particles that you breathe it in. Um, I think what's the other thing is it's very dangerous because people who have underlying conditions and lower immune system can't fight it off. People don't realize that a lot of people die from the flu and from pneumonia, but this is even worse. So people with asthma or diabetes or heart disease, um, have lower immune systems, and these are the people that are more susceptible to being on ventilators or being in hospitals because they've been very, very sick.
And yeah, and I'm glad you mentioned that, because a lot of times I see still a lot of people who underestimate the virus, and they see that, well, we've been through viruses before, and we had other viruses, and people were, didn't have to wear a mask, or I don't have to wear a mask. Um, what is it that we need to do, or what have you seen that is being done about communicating, educating our communities about how to take care of themselves, how to protect themselves, and what is it exactly that we need to be doing for us to protect ourselves and to protect others?
Well, the first thing is to protect ourselves. We need to limit the contact with others, especially those who are uh, coughing or sneezing, or have fevers. Those are signs of symptoms of this disease. So social distancing, meaning staying away from people at least 6 feet, wearing a mask, washing your hands all the time, because you never know what you're going to be touching doorknobs, and also sanitizing doorknobs and other places where you put things down, like for example, from the grocery store. You're bringing in food products and bags from the grocery stores, and so you have to be very careful about being indoors with other people, or being indoors, with people that are not in your family. That's why the restaurants, for example, we're told to have uh, minimal numbers of people, like 50% occupancy rate, or even now 25%, now that we're having surges. And for people to eat outside, the outdoor dining. Um, so I think we have to be more careful about, as we come to the winter months and it's going to be colder and people will be staying indoors more, being indoors with people that you live with, but not trying to visit and being in other people's homes is going to be important.
And thank you. And I wanted to, before I ask you the next couple of questions, if you can tell us a little bit more about the National Hispanic Medical Association, so our audience can get a feel about the membership and the types of members that you have, because then I want to ask you a little bit about how those members may be struggling with helping our communities, or how are they helping. So can you tell us a little bit about NHMA?
Sure. Sure. The NHMA, or National Hispanic Medical Association, was created with the mission to improve the health of our Hispanic communities and other underserved. We do that through advocacy. So our members are, I'm going to say, doctors and health professionals who feel they can add value to advocacy, whether in their states or at the federal government. We have meetings with Congress members and senators. Just in the last month, we've been in Florida, Texas, New York, and California, meeting with the state legislators, all virtual, but we've taken doctors and others that are professionals and students. We also have health professional students, and then of course, young residents or interns. And I think what's important is we not only do that to be able to provide a voice, but we ask the doctors, what are you seeing and what is your strategy on different, for example, with COVID-19, our speakers in our seminars that we've had are from the front lines. They're intensive care doctors, or they're, like I said, they're working in nursing homes or working in their own private practices. And I think I'll just say two major problems that they've had to deal with. One is the whole healthcare system had to stop working normally and stop elective surgeries, stop seeing patients in hospitals because the COVID-19 patients took over. And parts of the hospital that were not intensive care units became intensive care units. Nurses and doctors who were primary care family practice doctors had to learn to work the machines and the ventilators so that there could be more help for the sickest patients. And the other thing that happened is our medical practices and clinics lost money because their staff became sick. They had to close down, just like the restaurant businesses and other businesses had to close. Some are not coming back. So everything became an emergency about, COVID patients. And the other thing I think is the mental health and the well-being of the families of the doctors and the nurses. They couldn't go home and because they didn't want to give the virus to their sons and daughters and wives and husbands. So they've had to figure out how to either, stay in a different part of the house, take a shower, change their clothes when they got out of the hospital. And I think there's been a lot more isolation among people, and especially the frontline healthcare workers have had to deal with death and dying more than ever before. I've talked to people where they've said, we would have, maybe a few people on a shift. Somebody elderly would pass away, but not every hour. And so this has really taken a toll on the mental health of our of our providers, of the doctors and nurses that are taking care of COVID-19 patients.
Right. And it's already a workforce that was not enough, in order for us to serve the number of Hispanics in the country. I live in Atlanta, Georgia, and the Atlanta Journal-Constitution started running a beautiful series honoring these physicians and healthcare workers, because as you know, if someone gets sick and you take them to the hospital, they take the patient, but they don't let you in. Right. So you have all these patients, like you said, who are there by themselves in life-threatening situations, scared, and they don't have family members. So they're running this series where they're highlighting physicians, and hearing the story from the first person, from the physician first person, was really touching. Where they show the physician who's calling the family, saying, "Listen, I know you cannot be here. What can I tell your loved one, to make them laugh, to make them feel better? I'll go tell them right now. I know you can't be here." So not only are they working long hours with a deadly virus, but they're going out of their way to try and be not only the physician, but this loving human being who's there trying to support that patient's emotional well-being. Um, so it is something that caught my attention, that people are going above and beyond
Mhm.
what they need to go through now these days. Um, so we're having a couple of questions come in through the chat. One of them was, how do they connect with you and your resources? We did put your website at the bottom of the screen so individuals can access you through there. And I know that you do have a conference coming up, a
Mhm.
virtual conference, to
Right.
keep safe. Can you tell us a little bit about that, and how have you been able to interject COVID-19 into your conference?
Yeah, our conference is always in the spring, and this year coming up, it'll be March 17th through the 20th. It'll be a virtual conference. We usually have the federal government discuss what's new with the administration. So of course, and we have a new administration, the Biden administration. So I don't know who would be the speakers, who the Secretary of HHS or the Assistant Secretary of Health. We usually have them speak and address the audience about how we can help them. What is it that they're doing with COVID-19? And I think the biggest issue right now is the distribution of the vaccines that will be coming up shortly. The the distribution is important, not only to get to the country, but the importance of educating our communities on not being hesitant about taking the vaccine. So our job is to make sure that the audience who comes to the conference, and we welcome uh, all persons interested in learning about Latino health. Our conference is a national Latino health conference that discusses information for those that are in research. They want to learn how to do better research on Latino health, or those that are academic faculty that want to learn about how to teach better, how to teach to students that are not Hispanic about how they can take better care of their patients. Um, and then for those that are in the business of medicine, that are actually making a living, providing jobs in their communities for other people to help with a medical practice that might be a small group or a large group, or doctors working in hospitals, learning different ways of talking about COVID-19. And we are interjecting COVID-19, especially so that the doctors or others who come can share ideas from across the nation. All of our speakers, when we have our workshops, we share ideas from different regions of the country. As you know, Latinos are very different. So we have doctors who take care of the Cubans in Miami and the Puerto Ricans in New York and Dominicans, and as well as the Mexican Americans out in the West. And then of course we're very much concerned about the immigration issues and the issues of our elderly and just different types of topics, women's health, children's health. I mean, we have projects that we do to educate our communities about stopping vaping or stopping smoking. The issue of how to be better at preventing disease and like obesity and diabetes and heart disease. And with COVID-19, of course, it's going to be about like I said, the vaccinations that are coming out in the next month.
So speaking of vaccinations, I know that we've talked before about influenza vaccination programs, and what is the difference now, or
Mhm.
what should we be communicating to our communities about vaccinations?
Well, I think just like the flu vaccine, the virus has different ways of using the virus to put into a vaccine. Now, the COVID vaccines that are coming out right now from Pfizer and Moderna, the first two vaccines, are actually based on protein synthesis, that what's called an RNA molecule will create a way for the cells in the body to have uh, to start making their own proteins that will fight the virus. They're killer, what they call T cells. And then there's the other, there's B cells, B for beta, B cells, that actually um, stop the virus from attacking the body. So these vaccines are going to be very they're very effective. They're like 90% and 95% effective. Um, and we should see a decrease in the transmission of the virus as more people get the vaccine. One of the problems is that it has to be kept in very, very cold temperatures, and there will be refrigeration set up in different hospitals to get the vaccine to the local pharmacies. And the other issue is going to be that you have to have two doses. You have to get a vaccine and then go back and get a second vaccine about 3 weeks later. So what we have to tell our community is how important it is to take both doses, because you won't be able to fight off the virus without having both doses. Um, the other vaccines that are coming from AstraZeneca and Johnson and Johnson will the Janssen company out of Johnson and Johnson, they will be different viruses, different vaccines. I'm sorry, but still working on the same principle to fight the virus. You can't fight the virus without having the vaccine, so that you don't get it. You don't feel the ill effects of the virus if you have the vaccine.
And are these one time only, or is it an annual event like the flu vaccine?
I think the virus is going to here um, all the time. It's not like the flu that's seasonal. The influenza virus that we know as the flu happens in the colder months. So we usually have it from October until March or April. The COVID-19 disease has been all year round. And in terms of how long your immunity would last from the vaccine, I don't think they know exactly. That's part of the process of having a new vaccine, is following people to see how long the immunity lasts. Um, so it's an exciting time that they were able to come up with the virus, but with the vaccine. I'm sorry, but I think the vaccines happen faster because it is a different technology. And it's and it's also related to the SARS virus, and researchers and pharmaceutical companies had already been looking at how to develop a vaccine for the SARS virus.
Mm. So I guess the next step, which the new administration will probably need to take in, is distribution, right?
Hmm.
How difficult do you think that would be, and um, what can we do as a Hispanic community to advocate for the vaccine in our communities?
I think, our community has a lot of hesitancy, doesn't feel confident about getting vaccines. Uh, One of the major efforts is that the federal government is going to pay for the vaccines. So they will all be free to start out with. And the other distribution principle is that the healthcare workers will be given the vaccine first so that they can stay healthy and take care of everybody else. And then our essential workers, and who are many, many Latinos who are working in the food industry, who are farm workers, working in the meat plants, those working in the supermarkets, they will be also first in line. And also those who have underlying diseases, those who are the most susceptible to getting the sickest. So I think over the first quarter of the year, we will see certain people be able to be eligible for the vaccine. And they say by springtime, the second quarter, the March, April, May, the vaccines would be available to a lot more people. So I think what's important is that people take the time. Latinos, are notorious for taking care of everybody else except themselves, and take the time and leave work or leave studying and get the vaccines. CVS and Walmart have all agreed with the federal government and with CDC to help with the distribution through their many retail stores, pharmacies. And I think that our public health departments will have the vaccines, and the large hospital systems will have them. So I think who's going to have it last are going to be our rural communities and our smaller cities. So I think that whatever we can do to help people understand that you can get it if you drive to the bigger city, right? I mean, just like anything else, it's going to take time. But
Right.
but I think everybody's very, very hopeful that these vaccines will be taken up by our communities, and we really need to take it because the Latinos are the ones that are facing the most problems and deaths in our families.
Right. I mean, and we have data that shows health disparities within Latino communities. We do have some of the conditions that are more dangerous to have during COVID-19. Diabetes, obesity, and things like that. Um, so in our communities, though, one of the things that we always struggle with, and I don't know if maybe you can touch on this, is the misinformation that goes out there on how do we need to understand or comprehend or even treat the virus, and then how education really needs to be delivered. We had an issue here in Georgia with one of the large poultry plant that had a breakout, and that kind of gave way to this discovery that in this city that has a very, very large number of Latinos, there had not been any Spanish language COVID-19 information disseminated to a huge community that primarily spoke Spanish. And then people were kind of blaming the Latinos for not taking care of themselves when the information was never there in the first place. So is there anything that you've seen or that you noticed that we can do to help get this information or help educate?
Yeah, I think our public health infrastructure needs to be strengthened. And I think there needs to be more funding, resources, train the trainers, more of our community health workers, promotoras. It doesn't have to be the doctors that get educated. It needs to be the people in our communities that get educated about the importance of being healthy and living healthier lifestyles so they won't be so sick with this COVID disease. I really do think we need to change our whole concept of giving more funding to community-based organizations that are not hospitals and not medical schools, because it's the community-based organizations that help to educate people about health problems, uh, in the housing projects, in the churches, in the community, because our community doesn't go to the healthcare system until they're really, really sick.
Right.
And and so we have everything backwards. Prevention is needed with a major targeted campaign from the federal government for the Latino community and its leaders that are the small business leaders in our community that all need to be the role models, as well as the doctors and nurses who are trusted authorities for healthcare. They need to be more involved in the media, you know. So we really need a multi-pronged approach, but I think that there really needs to be, and I mean, Latinos have been here, and we're the largest ethnic group in the country, and we're always ignored. Mm. And it took a while for CDC to develop their information in Spanish, but there is information. All the local health departments are putting out more information, but we all need to have a better way of working with our public health departments, because that's supposed to be their job.
Right, right, and it's one of those things where we not only are the last ones to come in, but sometimes we choose to go to other providers, curandero, or take some tea that my mother used to make, and those kind of cultural issues. In this case, does that kind of cultural belief and cultural nuances help or hurt our community as we approach?
Well, I think it helps to be able to have less stress and anxiety in feeling that you are, doing what helps. Our traditional medicine has been passed on for generations. We have to accept that that is part of our culture. Right. But I think in this case, this virus is so deadly that we need to pay attention to the science and the fact that we do need to wear a mask, we do need to wash our hands, we do need to social distance. And if a city, the mayor's office in the city will tell you, whether the restaurants can be open or not, or if they're going to close down, we have to go along with that. And I also think it's important, just for the sake of our families, and also we really do need to get the vaccine once it's distributed.
And the other issue that I wanted to see is regarding testing. So we hear a lot about different types of tests, and some tests you get an answer in a couple hours, other is 14 days. What have you seen among your members and all the work that you've been doing? Is the Hispanic community participating in testing? Are we more cautious or not participating in testing? What have you seen about the COVID testing?
I think it just depends. Honestly, I do think Latinos are getting tested to be able to feel better, feel more comfortable, that especially if they're around somebody who has had a positive test. It's recommended that if somebody has a positive test and you're working around them or you're in contact with them, that within 5 days you should get a test. That's really the important time period. And then if you do test positive, you have to self-quarantine yourself to stay away from other people for at least 10 days. And I think what's important is you have to know whether it's positive or not. Part of the problem is the tests are, yes, the tests are different. It just depends on what tests got to what city. Again, it has to do with different companies making different types of tests. But I do think that one of the major issues is actually, the cities have been doing a great job in having free testing and testing where people are. Out in the West and the Midwest, you're having drive-through testing with large large parking lots. I know in Los Angeles at Dodger Stadium, they're using the Dodger Stadium parking lots for testing. Right. So, you know, they're trying to make it convenient where people are.
And the test itself, I also heard that there's a test that can tell you you're positive, but then there is another test that tells you if you've had it. The antibodies and
yeah,
so
the
what's
antibodies.
The difference about
well, I think that what's important to know is if you know, every test is only as good as the saliva or the mucus that is picked up on the swab. It's usually through your nose for the mucus in the back. But so you can have people that might have positive, but it's negative or you know, there's a little gray area there. But I do think that we're learning more about the importance. We don't know how long people stay once they've had it, how long they stay immune to getting it again. So, you know, but I think what's important is that the difference between the tests for a positive test is if you to have the virus, that means you have the virus now. An antibody test means you had it in the past. That's the difference.
Thank you. We have a couple of questions from the chat. One says, do you know if there is enough Latinx representation on the COVID-19 vaccine trials?
You know,
did they publish that?
Yes, the companies have actually, I think they've had about 15% Latino representation. They've actually done a better job than ever before. Most clinical trials have, you know, less than 5% Latinos. We're very underrepresented. I mean, just in healthcare in general, like I said, people are working so much or taking care of day-to-day priorities. They don't pay attention to their health. And, you know, the patients who go see a doctor in a hospital, for example, the doctors there might know about clinical trials and say, oh, you know, you might get some free medication if you go be a part of a research study. But most family doctors are not involved in clinical trials. So for the Latino patients who aren't, or Latino public not going to the doctor, it's harder for them to get connected to a clinical research study or a clinical trial. And I think again, this COVID-19 has been such a serious issue that the manufacturers, the pharmaceutical companies that have been creating the research have done a better job than in the past of increasing diversity. But there's very, very few Latinos in healthcare at all levels, doctors, nurses, dentists. We have very few that finish high school and college and then go on to stay in the education system to become the researchers or the clinicians in our system, to be able to especially talk to more Latinos about going into these trials.
Right. And so, I know that that's something that you have been working on, increasing the workforce. Can you tell us a little bit about that?
Yeah, we have a program called the NHMA College Health Scholars Program. And we have about 5 conferences a year in the West Coast, in Southern California, in San Antonio, Texas, and on the East Coast here in Washington, D.C. And we've run a couple hundred students at each conference. And right now we've got about 700 students in our program. And what we're doing is they're college students who don't know if they want to become a doctor or a nurse or a dentist. We don't care. We encourage all the different health careers.
Psychologists,
psychiatrists. But what we're doing is we're providing mentors from students that are already in those graduate schools to tell the younger students that I can do it, you can do it too. Mm-hmm. And that network is what our organization is about. We have senior researchers and junior researchers, teaching about the importance of getting involved in clinical trials, doing more research on Latino health issues. And in this case, with our NHMA College Health Scholars Program. And all of this is, people can get information from our website about scholarships. It's very expensive to stay in school and to pay these outrageous tuitions.
Yeah.
So we're very much interested in sharing information about how to finance a college education, especially for Latinos. And it's all on our nhmamd.org website.
Beautiful. It's another question that says, besides the prevention information that's being put out there, wash your hands repeatedly, wear your mask. And then we've also heard some of the symptoms of high fever, loss of smell, loss of taste. The one question says, what happens when you get COVID? What is it that happens that it progresses to where someone gets sick or dies?
Well, I'll just say it simply, that a virus is something that attacks your body and your body's cells. And your body naturally fights off germs and toxins from the air by creating more mucus to that's why you sneeze, or you might get diarrhea if the virus attacks your membranes of your intestines. So your system, your whole body, your heart can get affected, your lungs, your kidneys, your liver. So what happens is, those people who already have underlying disease have already damaged their bodies and the organs in their bodies. If you have bad asthma and are a smoker or a vaping, even for young people, you damage your lungs and you don't realize that they can no longer fight off the virus. And instead of trying to get rid of the virus damages the lungs so much that you can't breathe. So being short of breath has been one of the markers for a very, very sick person with COVID-19. And it happens within days, right, if the person already has underlying lung disease. And anyway, I mean, there's other, vascular problems, having, blood clots that go to your, if you have blood clots that go to your lungs and you can have an embolism and stop breathing. So there are different manifestations of the disease, but just say that it's because your body can't fight it off.
Okay.
And that's why younger people feel like they don't have to worry about it. Right. But even young people can have bad problems.
That's right. And we continue to see that. We continue to see very young people die or express some of the symptoms that we know the virus causes. Mm-hmm. Another question, and we answered kind of part of it, it had to do with the distribution plan for the vaccine, but there's a second part. Have you heard if there's going to be government grant funding to assist with the outreach in communicating the vaccination plans? Have you heard any of that?
Yes, there already is. And I think the federal government, our Congress, earlier this year has put out a couple of stimulus bills, relief bills, let's just say, so that there could be educational efforts around the disease itself. So, and these grants money has been given to all of the different agencies within HHS. I'll give you one example. The National Institutes of Health put out grants for community engagement research to understand what makes people respond to a disease and how you can help them understand the importance of vaccines. And those just went out in October. One of the HBC, the historically Black colleges, right, Morehouse, got a huge grant to be able to have partners for the African American, Native American, Hispanic, and Asian American communities. And they were given funding to develop community-based education efforts in certain parts of the country to see how that the people respond. And I know that and that money came from the Office of Minority Health for all minorities, but given to one school. But I do know that the Centers for Disease Control, that is a big prevention agency. We wrote a grant. We didn't get money yet because Congress is still trying to pull together and negotiate between the Republicans and the Democrats how much money they want to give to the next relief bill. But as money comes out of Congress, which money comes from taxpayers to Congress, and then Congress decides how much to give to what program, when they give money to CDC, we're hoping that we would get funded, or there was about 300 organizations that applied for funding for education purposes in our communities. And of course, we educate the providers as well as educating the public through social media and media efforts, that type of thing. But yes, the answer is yes. And I think with the Biden administration, there will be many more grants coming out about educating, especially the Latino community. I mean, we have to.
Dr. Rios, we're almost out of time. I knew time was going to fly. So in the last minute or two, can I probe you a little bit to share with us, what should we be preparing for? What should we be telling the next administration or other advocates to further help Hispanic communities be healthier in this country? What would you say we need to be advocating for?
I think we need all kinds of stakeholders to work together and be on the same page. That Latinos are not, Latinos do care for themselves and care for their families very much, and that they need more education in English and in Spanish. And we need a major effort in this country to have Latinos know about how to access healthcare. They don't apply for insurance. Latinos don't apply for screening programs or prevention programs. And the other thing is, on the other side, the government needs to pay for more programs like the mental health programs that you work on, like the college or high school programs that we work on. These programs need to be in all of our major regions of the country where Latinos are, run by Latinos. And we also need a much, much stronger leadership at the national level and the state levels within the public health departments that are Latino, because the part of the problem is that the people who run healthcare institutions, our medical schools, nursing schools, our hospitals, they're not run by Latinos, and they don't understand what we need. So I think that we really do need more, and I welcome anybody that would like to try to get into all the political jobs for the Biden administration. I'm very actively trying to help people get a job and to meet with the new transition team about the importance of hiring more Latinos.
Wonderful. Thank you so much, Dr. Rios. It's been such an honor and a privilege to have you here with us today. I hope our audience has really benefited from everything you've had to share. I will keep praying for all the work that you do. God keep you healthy and keep working for us, because, again, you're doing an amazing job. So thank you so much for being here with us today. I would like to thank once again NALBA's COVID partnership with Morehouse School of Medicine, quehacerahora.org, and the Conalma Health Foundation. And personally, I'd like to thank NALBA and our executive director, Fred Sandoval, for giving me the privilege to be here with you for the last two Platicas. From now, I'm Pierluigi Mancini. Thank you all so much. And Dr. Rios, have a beautiful evening.
Thank you.